latest now on the COVID-19 vaccine, and a new study from the CDC found pregnant women are getting vaccinated at a lower rate than their non-pregnant peers. Joining us to talk more about this is Dr. Zaher Merhi, a board-certified OBGYN and founder of Rejuvenating Fertility Center. Doctor, thank you so much for being with us.
Thank you so much for having me.
So first off, right off the bat, should pregnant women be concerned at all about getting one of these vaccines?
There is this misinformation, unfortunately, that the vaccine could be bad for you if you're pregnant or you're trying to get pregnant. But none of the data so far, fortunately, showed that this is true. Indeed, there is a recent study published today in New England Journal of Medicine, which is the best journal in the world, showing that the vaccine is pretty safe in pregnant women and did not cause any significant neonatal outcome or complications during the pregnancy at all.
So when you're dealing with a pregnant patient who is possibly reticent to get the vaccine, what is your strategy to try to convince her that this is beneficial?
So as a fertility specialist, I always tell patients, try to get the vaccine, before you get pregnant. Why not? If we have time, why not, right? Even though, when we put the embryo back in, I always tell them, don't take the vaccine too close to 2 weeks close to that, because, I don't know if you heard, a lot of people can get side effects, fever, chills, and stuff like that. And if you want to put an embryo back in, we don't want to, it might, again, I'm not saying it is, it might, theoretically speaking, because you're sick and you have fever, might lower implantation, or you might have an early miscarriage, even though these are really theoretical, there's no evidence for that. But if someone's trying to get pregnant and you have plenty of time, take the vaccine. It's 3 weeks, 4 weeks max between 2 doses. And I don't think it's going to affect much, delay your fertility treatment. So I highly recommend it to all my patients. As far as pregnant women, given the data so far and the published study so far, it seems to be extremely, extremely safe. But it's also shocking that only 16%, like you said, of women who are pregnant are, vaccinated or taking the vaccine. And also, it seems to be there is difference between ethnicities or races, if you want to say, between the intake, because that same study showed that Black women and Hispanic are less likely to take the vaccine compared to white and Asian pregnant women. So we need to kind of also increase awareness among everybody and all pregnant women that this vaccine seems to be safe so far in pregnancy, and there's no data that shows that it can infect you or the baby in any way or shape.
And unfortunately, that disparity you were talking about with pregnant women, we also saw in non-pregnant people, just the general population. Real quick, and last question here, doctor. In terms of the unborn baby, are there any benefits to getting the vaccine? Does it help them build some antibodies to COVID-19?
So there is some, case reports, not big studies, showing that some pregnant women who get the virus itself or the vaccine might transmit the antibodies to the baby and protect the baby. But as of today, it's very hard to say with confidence that this is going to protect your baby as well, because we don't know how long these antibodies can last for in the mom and ultimately the baby. So I cannot say this with confidence as of now.
But the bottom line is, as an OBGYN, you would recommend pregnant women getting the vaccine when they can?
Yes.
All right. Thank you so much for your insight and expertise, Dr. Zaher Merhi. Thank you so much for being with us. We appreciate it.